Good morning. In this brief session, I am going to teach you how to identify an abdominal viscera. The individual details of each viscera I will cover in subsequent videos. Thank you for watching this video.
This structure is spleen. This structure is also spleen. This is spleen because the superior border is notched. This enlarged spleen, again you can identify it by notching of the superior border. This urinary bladder of male, because prostate is attached there. You can see at the neck of the urinary bladder a prostate with seminal vesicles. This is the base of the urinary bladder. At the neck of the urinary bladder is attached prostate. So it is male urinary bladder. Opening into this urinary bladder are two ureters. Of these structures, identify this viscera. It is spleen. Identify this viscera. Again it is spleen. This one is also spleen. This is kidney, bean-shaped structure. This is also kidney. This is right kidney. Anteriorly placed renal vein, renal artery, and posteriorly there is ureter. It is an abnormal kidney. We call it as Y-shaped kidney because of its shape. Again, this is kidney.
Identify this wet specimen. It is stomach with anatomical and physiological sphincter.
This specimen is also that of stomach. This is a specimen of duodenum and pancreas. This is pyloric end of the stomach, followed by first and second part of the duodenum, then head, neck and body and tail of pancreas. This is liver with its diaphragmatic and visceral surfaces. It lies in right hypochondrium and epigastrium. This one is also liver with its diaphragmatic and visceral surfaces. This is a specimen of uterus. This is also a specimen of uterus. Let us start description of these specimens. So which structure is this? Is it right or left kidney? It is left kidney because from anterior to posterior structures at the hilum are is renal vein which lies anteriorly, followed by renal artery which lies in the middle, and posteriorly is renal pelvis
which continues as ureter and is directed downwards.
The poles of this kidney are superior pole or upper pole, which is rounded. It is covered by the suprarenal gland. Then inferior pole of this kidney, superior pole faces medially and inferior pole faces laterally in normal anatomical position. This kidney has got medial border which is concave, and this border presents the hilum of the kidney where structures either enter or leave. The structures which enter at the hilum are renal artery, Renal vein leaves, renal pelvis which continues as the ureter also leaves at the hilum. It has got two borders, medial border which is concave and present as hilum, and lateral border which is convex. The surfaces are anterior surface. It is also called the anterior lateral surface because in normal anatomical position it presents anterior laterally, and this one is called the posterior medial surface which rests on the muscles of posterior abdominal wall. It is related to psoas major, quadratus lumborum muscles. It is also related to subcostal vessels, iliohypogastric nerve and ilioinguinal nerve. Now the question is how to keep kidney in normal anatomical position. For that we take into consideration its poles. Upper pole is rounded and lower pole is smaller than the upper pole. At the hilum, arrangement of structures from anterior to posterior is: anteriorly there is renal vein, in the middle is renal artery, and posteriorly there is this ureter which is continuation of the renal pelvis. So arrangement of structures at the hilum from anterior to posterior is: renal vein anteriorly, artery in the middle, and pelvis posteriorly. Anterior lateral surface of kidney is convex, posterior medial surface of kidney is flat, upper pole is rounded as compared to the lower pole. Medial border of kidney is concave and lateral border of kidney is convex. Hilum of kidney faces towards the opposite side to which kidney belongs. For example, this is the hilum of left kidney, it faces towards the right side. This is duodenum and pancreas. This is also duodenum and pancreas. Is part of stomach. We have caudate end and we have the pyloric end. This pyloric end of the stomach. Here you will find that
Pyloric end of stomach is identified by the presence of muscular sphincter in contrast to caudate end, which presents physiological sphincter.
this uterus. You can see fundus, body, cervix, this ovary. This is an enlarged uterus. So we have three layers there: perimetrium, myometrium, and lining epithelium is endometrium. Attached to its angle is, or what we call as corner of the uterus is, this is right ovary. This is gut. Now how you will differentiate between small gut and large gut? In large gut you have three features, that is tinea coli represents the longitudinal muscle. This appendices epiploici, they are fat-filled peritoneal pouches, and this is what we call hostrationis or saculationis. Okay, and this mesentery of small gut. Within the mesentery you will find it is double-layered structure which attaches the gut tube with the posterior abdominal wall. Within the mesentery you will find their fat. In addition to fat, you will find their vessels, arteries and veins of the gut. And there are also lymphatics which we cannot see, but we can see the large lymph nodes, what we call as mesenteric lymph nodes. So you can identify, you can keep the kidney in normal anatomical positions by seeing the arrangement of structures at hilum. Renal vein leaves, renal artery enters, and ureter, which is continuation of renal pelvis, it also leaves.
Kidney has
Two borders, one is the medial border which is concave and lateral border which is convex, upper pole and lower pole. Between these borders lie anterior surface and posterior surface. Posterior surface of the left kidney rests on muscles of the posterior abdominal wall. What are the posterior relations of the left kidney?
Quadratus lumborum.
Where there psoas major, psoas minor and quadratus lumborum. In addition, there are subcostal vessels, iliohypogastric and ilioinguinal nerve.
the arrangement of structures at the hilum of kidney which help in site determination are from anterior to posterior. Renal vein lies anteriorly, artery lies in the middle, and renal pelvis lies posteriorly. So in case of right kidney, the arrangement of structures from anterior to posterior at the hilum is renal vein, in the middle lies renal artery, and posteriorly lies renal pelvis. So it is right kidney.
Right kidney, because we have anteriorly placed renal vein, in the middle is renal artery, and this renal
Ureter.
pelvis continuing as the ureter. It has got upper pole, lower pole, medial border which is concave, and lateral border which is convex. The shape of the kidney is bean shaped, or we say bean is kidney shaped, and two surfaces are anterior surface, posterior surface. Posterior surface rests on psoas major, minor, and quadratus lumborum. So the upper pole is related
to suprarenal glands. Upper pole of both kidney is related to suprarenal gland. Kidney has got two surfaces, anterior surface and posterior surface, medial border and lateral border, upper pole and lower pole.
anterior relations of the
Right kidney
here hilum. Here we have the duodenum. So above the duodenum we have their hepatic and colic impression. Hepatic is caused by the right lobe of the liver. Colic is caused by the hepatic flexure of colon, and lower down coil is of intestine. Now which kidney is this? Which kidney is it, right or left? From anterior to posterior, again the relations are vein, artery, and renal pelvis. Vein anteriorly, artery in the middle, and renal pelvis posteriorly.
Identify this wet specimen. This wet specimen is that of stomach because it has two ends, cardiac end which is a physiological sphincter and pyloric end which is anatomical sphincter. It has two curvatures, lesser curvature and greater curvature. To the greater curvature is attached greater omentum, and to the lesser curvature is attached lesser omentum. It has two surfaces, anterior superior surface and posterior inferior surface in living state.
It has two ends. One we call as the cardiac end. Cardiac end represents the continuation of lower end of the esophagus. The second is the pyloric end. See here pyloric end, again you will find this sphincter, what we call as pyloric sphincter. Okay, so it is an anatomical sphincter, and at the cardiac end we have physiological sphincter. So anatomical position of stomach is like this. So we have the cardiac end, and this one is the pyloric end. Between the two ends you differentiate by the presence, you can feel it here. So we have it here anatomical sphincter. If you open inside you will find there anatomical sphincter. So this is the anatomical sphincter. Then we have these two curvatures. This one is called
Lesser
curvatures. Where does it lie? It lies in the left hypochondrium, left epigastrium. So it is J-shaped. Shape can vary and size can vary depending upon how much food a person takes. So lesser curvature, which is the right border of the stomach, and it has a greater curvature. To is attached greater omentum, and it has two surfaces. This one we can call, in wet specimen we call it as anterior surface, but in living it is anterior superior surface, and this one is posterior inferior
surface.
Because when it is distended we call it as posterior inferior. It is supplied by the branches of the celiac trunk. Left gastric artery, then left gastroepiploic artery, then we have the short gastric artery for fundus of the stomach. Now hanging from its lower border is the greater omentum. Greater omentum is again double-edged fold of the peritoneum. It contains blood vessels, nerves, lymphaticus, and fat. Greater omentum is called the policeman of the abdomen because it was believed that it moves to the site of infection, seals the perforation. Just for example, if there is rupture of the appendix, it moves there and seals it, thus localizes peritonitis. But the recent concept is that it moves to the site of inflammation by chance, not by choice, because the only muscle present in it is the muscle which belongs to the blood vessels. So it cannot move of its own, it moves there by chance and seals perforation. Now what is lesser omentum? With the lesser curvature of the stomach, between the lesser curvature of the stomach and liver is a double layered fold of peritoneum that we call as the lesser omentum, or it is also called gastro-duodenal hepatic ligament because it is attached to the lesser curvature of the stomach, it is attached to the first part of the duodenum, and it is attached to the liver on the other hand. So the structures in the free margin of the lesser omentum are, what are those? So we have free margin of the lesser omentum. In that we have three structures important are portal vein which lies posteriorly, hepatic artery, CBD, common bile duct.
D for dextro. D also stands for duct.
D for dextro, it lies on the right side and anteriorly, and hepatic artery, again it lies anteriorly and on the left side. So the arrangement of the structures, so duct is on the dextro right side and it lies anteriorly, artery anteriorly, hepatic artery and anteriorly, and posteriorly we have portal vein. Posterior to that we have inferior vena cava. So what lies posterior to the stomach is lesser sac. So lesser sac communicates with the greater sac through epiploic foramen. So what are boundaries of epiploic foramen? We have free margin of the lesser omentum anteriorly, posteriorly
Inferior vena cava. Superiorly there is
caudate lobe of liver, and inferiorly there is first part of the duodenum. It is slit-like opening from where secretions can go from lesser sac into greater sac. Okay? It is also called foramen of Winslow or epiploic foramen or additus to lesser sac. Lesser sac is formed as a result of rotation of the gut tube. So this is greater omentum, lesser curvature of the stomach, greater curvature of the stomach.
Cardiac end.
This cardiac end of stomach, this is
Pyloric.
pyloric end of the stomach. This is anterior superior surface and this one is the posterior inferior surface of stomach. Finish?
Thank you for watching this video. Do not forget to like, subscribe and share this channel. The description of individual organs will follow in my subsequent videos.